Hello, and welcome to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. I am your host, Lillian Agwegbe, your friendly community health educator. And I'm excited to be talking to another public health professional today. I'm talking to a public health professional that is really at the start of her public health journey. Rickayla, you're welcome to Your Public Health Professional and You.
Hello. Hi. Thank you for allowing me to be here. I'm excited.
Great. So please tell us a little bit about you. Who is Rickayla Dixon? And just about you, like where you from and where do you go to school currently?
Yes, so I'm from the DC area. I currently attend Towson University. I'm a senior majoring in public health. Um, I'm a part of the MDPHA communications committee, and I also co-founded a club at Towson University called Towson University Students for Public Health.
Awesome. There's so much to unpack there, but I'm going to start with public health. So you're a senior, you're at Towson University, and you're majoring in public health. How did you get to public health? Why not architecture? Why not in law or something else? What was the attraction? How did you get to public health?
Yes, so I originally started out my college career as a pre-nursing major. I wanted to go into nursing just for the flexibility and being able to know that I'll be able to help those in maybe the hospital setting. But as I have been a lot more involved at school, I chose to go the public health route because I feel as though with public health, I'll be able to impact a whole community versus doing micro connection.
Awesome. Now, do you think that there was a lot of incentive, or let me say, awareness from how easy was it for you to think about public health as a choice? Did you have information about public health in your school from public health professionals? Who were the people that really helped you make that pivot to choose public health?
Yeah, so honestly, I didn't know much about public health, and because public health is really broad, and I didn't know that at first. I honestly only really chose to go the public health degree route because a lot of my prerequisites aligned with nursing. So that it wasn't until I actually got into the major where I was able to know, like, oh, you can do this with a public health degree, you can do that, you can get into this. And I do feel as though, or I'm hoping that in the future, public health could be a lot more known for people who don't know what it is, and then that the degree could be of interest for them.
Awesome. So what I hear there is that there's opportunity for us in public health to do more about making the profession known to young and upcoming professionals as a choice. Okay, so
Yes.
somehow you found your way into public health, not so much because we did the hard work, but you somehow found public health. Now, how has it been since you found public health? What has your experience been as a public health student?
Yeah, so I would say that I've done quite a lot of things. Again, I co-founded a public health-based club/organization called Towson University Students for Public Health, and we're one of the 4 student chapters of the Maryland Public Health Association. So that was very cool. I also, this past summer, I interned at the University of Pittsburgh for the Center of the Seas John R. Lewis Scholar. And I was able to work under mentorship and do my own personal research and evaluation on the health department. I'm currently in the process of starting to do more research. I'm hoping to go the more international route, just so I can just broaden my horizons. And I'm also the assistant director of the Student Government Association for the Health and Wellness at Towson University. And I've been able to do public health related interventions such as a distress week. The most recent one was a distress day for those who are about to take finals, and because finals can be really stressful for college students, so we partnered with a whole bunch of student orgs to try to give out information and goodies just to kind of like relax students before they enter into their finals. So that's a little bit of what I've been doing.
Awesome. I really like when you talked about this rhetoric because, one of the things we say about the public health professional or public health professionals are that they're working for people that they're not going to meet. So I can imagine that your student body is really very large. And there's
Yes.
some students who benefited from this intervention but didn't know that somebody may have passed you in the hallway and not even know that you had anything to do with that awareness event.
Yep. Agreed.
So that's what we say about public health professionals. We're working out for the good of the public, whether they know who we are or not. You, as a professional, and your colleagues have looked at exams, final exams, and have looked at it as very stressful. And we know that stress can lead into other things. And so you're like, okay, how do we mitigate this for people who are in school and who are taking exams? And the public health professionals, based on the research that has giving us this information about increased stress rates during exam period, you now designed an intervention to share information and goodies and tips for relaxation with members of the school community. And that's how public health works for people. Now, beyond that, I know you said you wanted to go the international route. Are there some particular public health issues that you're interested in terms of research or interventions?
Yes. So currently, the only one I'm interested right now in is the maternal mortality rate in Africa, because some countries and nations in Africa have high maternal mortality rates, and then some of them have low. So I hope that I can kind of determine like what are some social determinants of health that may affect certain parts of Africa, and how can we, I don't know, maybe bring resources or other organizations to improve the maternal mortality rates in certain areas.
I absolutely love that interest area because it's also one of the areas that really highlights the difference between public health and medical health. So a pregnant person is going to
Yeah.
go to hospital and going to have the baby at the hospital. Yes, they're going to need medical practitioners. They have to be seeing their gynecologists. They have to um, be with the triage nurses or the delivery nurses and all of those people. But he said something important: social determinants of health. Those are things that are going to happen to the pregnant woman outside of the hospital. And somebody has to know about it, and somebody has to be working with them about it. Somebody has to know whether have food and they're eating the right food. Somebody has to know whether they have transportation to get to the hospital. Somebody has to know whether they're working hard, resting enough, and how they're sleeping, and whether they have a social capital, whether they have a social support system, and so many other things that they have to do before they actually get to the point of going to deliver the baby, because it's not only the hospital that will keep them safe. That's correct, right?
That is correct. I like to think of public health as the holistic version of medical, because, like you said, we look at everything, like the environment you're in. Do you have the support that you need? What can we do to make that aspect easier for you, so that when you do get to the hospital, the medical providers can care for you and you'll already have things set up. So I 100% agree.
Awesome. Now, there's something you said earlier I was going to come back to, and I think now is a good time to. You said you founded a public health association for students in your university. What was the motivation for that, and how have the students responded? What do you hope that you can accomplish by that association?
Yeah, so public health. So when I first got into the field, we called it the Health Education and Promotion, and then they had changed the name to Public Health to make it a lot more broad, and they offered a lot more classes related to public health. So when the name was changed, a group of us, we decided that there should be like a organization because again, public health is so broad. So when I started the major, I was like, what would I do with a public health degree? And and I was a junior at that time. So for the freshmen or sophomores who are or transfer students who are entering in college and don't really know what they want to do, a group of us decided that maybe a club would be useful to like spread to highlight public health and what it is and what you can do. Just yeah, and so then we formed a club, and we've been trying to do collaborations to kind of get our major and minor put out there for students who are struggling to like identify what they want to do.
Awesome. I like that idea because somebody is new and the profession itself is new and people are coming into the field. And so what do we do? Who do we collaborate with? What are our partners? Where can we work? Who are the sort of people that work in the field? How does the individual passion align with something someone else is already doing? So I really like that idea. And I know that you're a student wing of the Maryland Public Health Association, the producers of this program. So if you don't mind, tell me a little bit about your experience with the Maryland Public Health Association. I say that to say we have some public health professionals and some students that are not aware or not affiliated with the Maryland Public Health Association. So, what has been your experience and what would be your advice to people who haven't joined the association yet?
Yeah, so there's a lot of good benefits of the association. I'm still personally like I find out about a whole bunch of new benefits every time I open the emails. But like I said earlier, there's so many committees that you can join. I'm a part of the communication committee, and we're mainly the backbone of social media. So we try to be a lot more active for those who are on social media, such as Instagram, Twitter, YouTube, Facebook, all of that. I think there's also other committees like the finance committee and the advocating committee, I believe. Also, with the membership, you get monthly letters, and the letters are really good because it lets you. They have job offers on the letters. They have like what's been going on this month, upcoming events, so you can stay in. They try to keep you in the loop as much as possible. And then with the Maryland Department, the Maryland Public Health Association, you get to do a lot of networking, and networking for this field specifically is very very important. So with the networking, you can meet people that you might be interested in a certain field, and yeah, since it's such a broad, you can like talk to those who have their foot in the public health field, and you can kind of get advice, maybe even find mentorships, and it's a great association to be a part of.
Great association to be part of. Now, when you said networking is very important, that's because, like we talked about earlier on, you're talking about public health. Social determinants of health is a big component of what happens in public health. We need policies to change. You usually have to advocate for that. You need funding for in programs. One person can't do it alone. And so you have to be working in collaboration with partners, not just in your field, but across field. You might want to work with people in the educational sector because you need, people to be more educated. You want to work with people in the housing sector, in the employment sector. So you want to be collaborating with a whole bunch of people. And the Maryland Public Health Association does that. Now, what you said about the newsletter also is, when you get on social media, there are tons and tons of information. Which one is relevant to you? How do you know that? Well, the newsletter really goes through that and say what is happening in the field of public health, what webinars are going on, what trainings are going on, which one should you pay attention to, what job vacancies are in the field. And you get all of that information in our newsletter, which you get if you're a member of the association. I don't know for students, I can't remember. Does your school pay for you or do you have to pay to be a member?
So we do have to pay to be a member. Depending on the grants that we received, I know the first year we were able to have our membership paid for free. So if organizations or schools want to try to form a student section, I would encourage y'all to look for grants so that fees can be covered. But I think the membership fee for students is only like $25. So it's very affordable.
Very affordable for students and even for working professionals. It's just like you go to our website, www.mdpha.org, and you can get more information about what the membership fees are. And yes, professionals pay different fee from students. I like that idea though about, student organizations if they get funding. So, hey, if you're a professional organization, guess what? And you're saying part of your corporate social responsibility is helping in the society, you can actually sponsor some students to become members of the Maryland Public Health Association. So go on our website, email getinfo@mdpj.org, and you can let us know whether you want to sponsor some students to be members of the public health profession. Now, Rickayla, we're rounding up our interview now. I wanted to find, is there anything that you'd like people to know about public health professionals? If there's somebody, so let's do this. Let's talk first to somebody who's a student out there. Maybe they're still in middle school or in high school, and they're thinking, "Oh, I'm going to do this and I'm going to do that," and they don't know about public health. They don't know about the profession. What would you say to that person about getting them to think about public health as a profession that they might want to be interested in studying?
Yes, so for a middle schooler, I would suggest just doing your own personal research. Um, Determine what you think that you can handle and what you think you can't handle. Like I know a lot of people say that they want to go in the medical field, but then when they get in their blood, they get squeamish. So maybe there's something in the field of public health that you can do, that you want to like help communities, but you don't have to deal with like the blood and the throw up and stuff like that. So I just say do your research or ask questions, ask your teachers, and yeah.
Do your research, ask questions. I like that. We said this at the beginning. Public health profession is really a very broad field. If you think you're very sciencey, and there's room for you at the public health field, being a biostatistician. You can work on analysis and formulas and things like that. If you're like a food person, you can become a nutritionist. If you like to talk to people, you can be a community health educator and advocate. If you're like, I like to ask questions, but I like to work behind the scene, you can be a researcher developing and conducting the research. And if you're like, well, I really want to understand how things work and how we can make things better, you can be an evaluator, right? So there's so many different tracks that you can be in the field of public health. And like Rickayla was saying, look for your passion and find something that aligns. And chances are that you'll find a public health profession that aligns with you and your goal.
Yeah, and just to add on to that, for those who are able, I would say get as much experience as possible. Maybe do some internship, do some shadowing to kind of see what you actually want to do or what sparks an interest in you. And even if it's something that you don't think you would be interested in, still try it because you never know.
Right, and you said so. The next thing we're going to talk about is to students and professionals. Now, you said the association you formed is one of 4 student associations of the Maryland Public Health Association. So, how difficult or how easy is it if there's some students in some university and they don't have an association just yet? How can they go about setting one up?
Yeah, so if you are nearby, maybe you can join one of the associations that's on a close by campus. But if you want to start your own, you can look up how to start one on the association website, and you could just ask around, ask questions. You can reach out to current organized student chapters, such as Towson University. I think there's one in Coppin. So just ask around. Maybe you can start your own on your campus. It's fairly easy process, but all that could be looked up on the website, or again, you can ask one of the student chapters.
All that can be looked up on our website, www.mdpha.org, and learn about the public health professionals in Maryland. We also partner with tri-state areas there. We do with the Delaware Public Health Association and the Philadelphia Public Health Association. We have a tri-state conference that is going to be coming up sometime in the first half of next year. And we just had our own state annual event last month, which was a phenomenal event about restoring trust in public health. And that's actually part of why we do all these programs, because we just found that people don't know about public health that much, like Rickayla was saying. Was something that she sort of stumbled into. So there's much work to be done in the field. Do you have some word of like advice about where we should go to, what should we be doing about getting the word out there for professionals, young people, or anybody to come into the field? I know you say you work in communications, well, social media, but any last words for our audience today?
Yes, I think community outreach would be helpful when spreading the word about the field of public health. A lot of people know what teachers are, what doctors are, but not a lot of people know what public health professionals are. So the more community outreach we can do, the more we can highlight public health professionals and the many aspects in which you can go. And if you're a part of the profession, don't be afraid to like talk about what you do or the other things that you could do to younger audiences, so that they can kind of have that in the back of their mind. Oh, well, Rickayla, she said she was a public health professional and she seems really cool. Maybe I should look into that profession.
Awesome. Any last words for us before we sign off today, Rickayla?
No, I'm so grateful to be here. Thank you for interviewing me.
Thank you so much for being on. My name is Lillian Agbayegbe. I am your friendly community health educator. You have been watching Your Public Health Professional and You, a program of the Maryland Public Health Association. And we're working for the health of all Marylanders. And we, as public health professionals, really work for the good of members of the public. You may not get to meet us in person, but please know that we're routing for you and we want you to live best quality life. Until I come your way some other time, thank you for watching. Bye.